Welcome to the third session, webinar session on general comment number 2 of the Maputo protocol. My job is easy today. I'll just be a moderator for this panel with the great panelists that we have. My name is Dr. Satang Nabane. I am a postdoctoral fellow at the Center for Human Rights at the University of Pretoria, and also a member of ISLA's panel of experts. I am an activist, a scholar, and a researcher, and I have a particular interest in the Maputo protocol generally. For this particular session, which is titled General Comment on the Right to Safe Abortion and Access to Contraceptives, Is It Effective? We know that the African Commission on Human and People's Rights adopted General Comment number 2 to interpret provisions of Article 14 of the Maputo Protocol in 2014. The provisions, Article 14, generally relate to the provisions in relation to women's right to fertility control, contraception, family planning, information, and education and abortion. The rationale for this session today is to talk about General Comment number 2, discuss especially in terms of how effective it has been, what the impact of the General Comment is, and how we can move forward, especially in ensuring the implementation of the General Comment, which is General Comment number 2 of the Maputo Protocol. In terms of the outline of the program or the webinar, I'll just do a quick introduction of the distinguished panelists that we have. And then we'll have both speakers. We have two speakers. We'll have both speakers speak on the General Comment. And then we'll have an animation, a documentary played as well in relation to General Comment number 2. And then we'll also open up the session for Q&A. And we hope that this will be a very engaged session as well. At this point, I want to introduce the first panelist, who is Dr. Ambassador Brookman Amisa, who graduated from the University of Ghana Medical School in June of 1970. She is a fellow of the West African College of Physicians and a fellow of the Royal College of Obstetricians and Gynecologists of the United Kingdom. Since July 2014, she has been in semi-retirement, first as special advisor to the Ipas President for African Affairs, and currently supports global programs and initiatives in women's reproductive health and rights. Most recently, she has been a member of the Technical Advisory Group, TAG, working with the Population Reference Bureau, PRB, to develop evidence-based policy to expand access to safe abortion, and is also a member of the External Reference Group for Amnesty International for review of their abortion policy. In December 2020, she was invited to be a member of the Africa-Europe Strategy Group on Health. She has served in the government of Ghana, first as Minister for Health, and then as ambassador to the Kingdom of Netherlands. From 2001, as Ipas Vice President for Africa, Dr. Ambassador Brookman Amisa set up and directed the Ipas Africa Alliance for Women's Reproductive Health and Rights, the Africa Regional Office of Ipas in Nairobi, Kenya. Her leadership in advocacy work with regional and national institutions and organizations, including the African Union, agencies, sub-regional health agencies, national governments and legislators, the women's movement, health and legal professional associations, youth leaders, and the media, among others, have brought the highlights in relation to the work that she does. We are very honored to have you here with us, Dr. Ambassador Brookman Amisa, and welcome to this panel. And thank you for joining us. The second speaker that we have is Suzanne Majani, who has a decade's experience in engaging with policymakers at the regional, national, and sub-regional levels to protect, promote, and fulfill women and girls' human rights through policy and formulation and legislation by way of thinking, strategic thinking, analysis, partnerships, and knowledge sharing. She began her career by volunteering at the UN Millennium Campaign, advocating for the MDGs to be recognized and claimed by ordinary citizens. Subsequently, she worked at the Federation of Women Lawyers, that is the FIDA Kenya, seeking to improve access to justice by poor and indigenous women in Kenya. Thereafter, she worked at the Coalition of Violence Against Women, training women and girls on recognizing the different forms of violence and assisted them to seek redress for these violations through the justice system. Suzanne is currently the policy advisor at Ipas Africa Alliance, advocating locally and continentally for policy change and legal reform to provide contraceptive information and services and reduce maternal deaths and disabilities from unsafe abortion. She graduated with an LLB from Moi University in Kenya and is currently pursuing a master's in public policy and management from Strathmore Business School. Thank you, Suzanne, and welcome to this panel. Before I called on our first speaker, I just wanted to sort of all lay out the context in relation to the Maputo Protocol and unsafe abortion in Africa. I know I do talk quite a little bit fast, so I'm trying to go a little bit slower so as to make the jobs of the interpreters easier. In relation to unsafe abortions and in Africa and the Maputo Protocol, we do know that unsafe abortion is linked to the criminalization of abortion, which remains a major public hazard and human rights challenge in the African region. It is, and as evidence shows, it is one of the main causes of maternal mortality and morbidity in Africa. The WHO actually estimates that each year, unsafe abortion is responsible for the death of at least 29,000 women and girls. The Guttmacher Institute also estimates that majority of women of reproductive age in Africa live in countries with highly restrictive abortion laws. In 2003, Africa took a global lead in terms of inscribing abortion as a human right under the African human rights system. Specifically, the African Union adopted the protocol to the African Charter on Human and People's Rights on the Rights of Women in Africa, which is commonly known as the Maputo Protocol. Specifically, Article 14.2c of the protocol requires states to permit abortion where pregnancy poses a risk to the life or health of the woman or to the life of the fetus, or where pregnancy is a result of sexual assault, rape, or incest. Since then, more than 2/3 of African states have ratified the Maputo Protocol. In order to ensure that there is more elaboration in relation to that specific provision, Article 14.2c of the Maputo Protocol, the African Commission in 2014, given the persistence of abortion-related morbidity and mortality, and also the gap in relation to the implementation of states' obligation related to issues around unsafe abortion, the African Commission adopted General Comment number 2, which mainly provides guidance to states on the interpretation and implementation of women's right to safe abortion in Article 14. The panelists will go more in depth in relation to what the specific provisions are, but also in terms of what the context of the General Comment number 2 is and what it means for, specifically what it means for states, especially in relation to ensuring that they are addressing unsafe abortion issues in Africa and in their respective countries. I just wanted to highlight, and I'm sure the panelists will also talk about it, that the General Comment also builds on existing work by the African Commission, including the campaign for the decriminalization of abortion in Africa, which was launched in 2016 to promote greater protection and respect for sexual and reproductive health and rights. I think the reason why we're here today is that despite the very progressive provision in the Maputo Protocol, despite the very progressive General Comment, which really lays out in-depth obligations related to implementation of Article 14 of the Maputo Protocol, we do know, and as I highlighted earlier, that unsafe abortion still happens, that women in Africa, most women in Africa actually live in restrictive settings, contradictory to what is provided for under Article 14 of the Maputo Protocol. As a result, that's the reason why we're here in terms of the effectiveness of General Comment number 2, but also, as I said, in terms of thinking forward, in terms of thinking around the way forward, especially in addressing some of the gaps in relation to the implementation of the General Comment. As I said, I'm the moderator, so I'm going to try to not talk too much. At this point, I have the honor to welcome Dr. Ambassador Brookman Amisa to give us an introduction to the General Comment. Why the General Comment? What does the General Comment entail? You're welcome, Doctor. I think Suzanne will project your PowerPoint.
Thank you very much.
Yes.
For the kind introduction. Good afternoon, everybody. From wherever you are, I am joining you from Accra in Ghana. And it's a pleasure to be part of this program and to have the opportunity to share with you in the short time available today, the background to the General Comment number 2 of the African Commission. I was privileged as Vice President of Ipas at the time to be a prime mover in the development of the document in support of the African Commission's efforts to give meaning to the provisions of the protocol to the African Charter on Human and People's Rights on the Rights of Women in Africa. It was an exciting time for everybody involved at the time, and the adoption of the document was hailed and widely celebrated by all who care about human rights, and especially about women's rights, and in particular, neglected and critical rights issues relating to contraception and access to safe abortion. So my presentation today will look at the status of abortion and family planning in Africa, just briefly, and then the purpose of the General Comments, the rationale for the General Comment number 2, and a look at the prevailing policy environment at the time, and the development and the adoption. And then we'll look at the importance and usefulness of this document, and then other important developments that need to go together with the General Comments. And then we'll look at how we can use it in advocacy and the way forward. So General Comments are authoritative interpretive guidance issued by the UN or regional treaty bodies to aid states in their implementation of human rights treaties. They are quasi-judicial guidance to help states to achieve treaty objectives. Through General Comments, treaty bodies clarify the nature and extent of the normative content of ratifying states' treaty obligations. By clarifying the obligations of the state as a duty bearer, General Comments necessarily also clarify the corresponding rights conferred on individuals as rights holders. Although they do not constitute binding law, General Comments can be invaluable in promoting the objectives of a treaty, especially when they seek to clarify treaty obligations in areas that are novel and for which there are no precedents or that are historically, morally contested or stigmatized. General Comments are particularly important for providing interpretive guidance in areas where human rights remain unprotected, as is the case with women's reproductive health, and especially unsafe abortion. So briefly, this is the scourge of unsafe abortion in Africa. There are over 40 million abortions worldwide, and 22 million of these are unsafe globally. Of these 22 million, 6.2 million, that is a full 28%, are in Africa alone. And of the 47,000 deaths globally from unsafe abortion, 29,000, that's 62%, are in sub-Saharan Africa. And then this amounts to it results in 1.8 million hospitalizations in Africa yearly for unsafe abortions, which constitutes a huge drain on our scarce budgets. And sadly, unsafe abortions also contribute up to 30% of maternal mortality in some of our countries. And then this is the status of family planning, which is not as controversial as abortion, but it's equally neglected in Africa, far more neglected than it should be. Contraceptive prevalence rate is still very low. The unmet need for contraception is unacceptably high. Up to about 36 million women who need contraception are not able to get this. And this contributes to unwanted pregnancies and unsafe abortion. And especially the contraceptive needs of sexually active adolescents is not catered for by states in the way that it should. So let's look at the prevailing environment that gave rise to the general comment and the protocol that preceded it. Between 1994 and 2000, we mainly had the ICPD program of action with additional language from the further review, mandating countries to provide safe abortion within their national laws. And we also had the Beijing platform for action, which urged countries to decriminalize abortion. And then we had the Millennium Development Goals that called for reduction in maternal mortality without reference to reproductive health. Between 2003 and 2005, the Protocol on the Rights of Women in Africa was adopted and came into force. In 2006, Africa developed its Maputo Plan of Action, which called for countries to reduce the incidence of unsafe abortion. And since 2010, AU institutions and departments have been sensitized and fully supportive of access to safe abortion for African women. And these include the AU Department of Social Affairs, responsible for health. It was also around this time that the African Commission became engaged with unsafe abortion, and commissioners were sensitized to the issue. Between 2012, 13 to 14, the world was preparing for the new Global Development Goals and the Addis Ababa Declaration for ICPD. What was the rationale for the protocol from which the general comments emanate? The African Commission on Human and People's Rights, or the African Commission, adopted the protocol on women's rights as more than just a supplement to the African Charter. It was the outcome of intense lobbying and advocacy by women's organizations in the African region. African women literally pitched tent and laid siege in Addis Ababa until they got what they wanted. There was a realization that despite African states' ratification of treaties and international human rights instruments based on the African Charter, including the Convention of the Elimination of All Forms of Discrimination Against Women, CEDAW, their protection of women's rights at the domestic level remained weak or non-existent in many sectors. Through the protocol, the African Commission hoped to respond to widespread concern about the lack of effective protection of African women's rights. The AU protocol, it's of note that Africa has the only international human rights treaty that explicitly enumerates access to safe abortion as a right. Huge as this is, it was also the subject of intense negotiations and give and take, but it was a real trailblazer and still is the only one, and calls for member states to authorize medical abortion in cases of sexual assault, rape, incest, and where the continued pregnancy endangers the mental and physical health of the mother or the life of the mother or the unborn child. And it also makes reference to family planning. Under the African Charter system, the adoption of general comments falls under the mandate of the Commission, of the African Commission, under Article 45 of the African Charter. The African Commission must provide guidance to African states to help them comply with their treaty obligations, including through domestic legislation. The African Commission's adoption of general comments should be understood in this light. It is a process that serves to complement the mandate of the African Court Human and People's Rights, which is otherwise charged with matters of interpretation arising out of the application or implementation of the protocol. And in the history of the human rights system based on the African Charter, the general comment on Article 14.1 A, B, C, and F, and Article 14.2 A and C of the protocol represented only the second general comment adopted by the African Commission. The African Commission first adopted a general comment in 2012 on Article 14.1 D and C of the protocol, clarifying the provisions relating to the rights of women to protection against sexually transmitted infections, including HIV/AIDS. The objective was to ensure that women can fully realize the sexual and reproductive rights guaranteed by the protocol. Given adequate political commitment, general comments can become a source of important guidance to legislators and policymakers on how to implement abortion laws in ways that facilitate access to safe abortion services. So now for a look at general comment number 2. That is a document, and I urge you all to find it and have a look at it. General comment number 2 on Article 14.2 A and C of the protocol is significant in terms of promoting the objects of the protocol, and in particular, promoting access to safe abortion and effective contraception for all African women who need them, and to advance the sexual and reproductive health and rights of women. General comment number 2 elaborates on the right to sexual and reproductive health as provided for in the Article 14 of the Maputo Protocol, and provides guidance on the process for law reform and implementation. It is also an important reference point for governments and civil society organizations engaging with the African Commission during reporting sessions, especially shadow reports by CSOs. The guidance is backed by the authority of the African Commission, is irreversible, and will long serve as a tool for reproductive rights advocates in the region. So how did it all come about? At the African Commission session in November 2012, the Commission launched Article 14.1 dealing with STIs and HIV, as I mentioned earlier. The Ipas Africa Alliance discussed the idea to do similar with Article 14.2c, and the then Special Rapporteur on the Rights of Women was very much in favor of this. We considered working with the Center for Human Rights in Pretoria University, Faculty of Law, but in the end, an experienced and renowned policy expert who was conversant with the general comment process, and especially also very knowledgeable about the AU Women's Protocol, was contracted to lead the development of the general comments. A group of eminent human rights lawyers and human rights experts was identified to comment on and help guide the development of the draft. Following that, a two-day meeting was convened by the then Special Rapporteur on the Rights of Women in Africa and Ipas, and comprising of experts, including legal luminaries, human rights lawyers and practitioners, health and advocacy experts, parliamentarians, and civil society representatives, as well as youth representatives. This was held in Nairobi to validate the document. And the final draft was sent to the full assembly of the African Commission for adoption. And this eventually happened at the 55th session, ordinary session, held in Luanda in May 2014. So what is the importance and usefulness of the general comment? The general comment interprets provisions of Article 14 of the protocol, which guarantees women's rights to fertility control, to contraception, family planning, education, and abortion. However, the general comments expand these concepts with respect to abortion in ways that could otherwise remain unknown by policymakers by the courts, by human rights defenders, and civil society in general. For instance, in its conceptualization of health, which is one of the indications for access to safe abortion, general comment number 2 reflects the WHO, the World Health Organization definition of a holistic concept of health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. The general comment further clarifies the state's obligations by drawing guidance from the technical guidelines and standards also issued by WHO in its publication, Safe Abortion, Technical and Policy Guidance for Health Systems. The general comment clarifies the abortion provisions of Article 14 on how abortion grounds should be understood. This is very important. Again, drawing from the technical guidance of the World Health Organization, the general comment explains, for instance, that when applying a holistic understanding of health as a ground for abortion, the woman's reasons must be taken into consideration. Furthermore, where risk to mental health is relied upon, it is not necessary to first establish psychiatric evidence, for instance. Because nearly half of African states permit abortion on the ground of the pregnant woman's health, this clarification is potentially enabling in most African countries where there are no precedents. The general comment again clarifies that states have a duty to remove restrictions that are not necessary for providing safe abortion services, such as the requirements for multiple signatures, approval by committees before an abortion can be performed, or restricting performance of abortion to only medical practitioners, that is doctors. Where there are not enough doctors, as in most countries in Africa, states should enable other cadres, such as midwives, to perform procedures for which they can be trained to do competently and safely. The general comment's human rights value goes beyond providing states with guidance for framing their domestic laws, practices, and policies. It's also invaluable in educating all stakeholders at the domestic level about pertinent jurisprudence. Civil society and human rights advocates can use the general comments to render the state accountable for failure to implement its treaty obligations. I thought I would briefly mention other documents and developments that we need to know about and which should be used collectively with the general comments in our advocacy efforts, as well as implementation of safe abortion services. Following a workshop in 2012 for African ambassadors to the African Union in Addis Ababa on abortion, there was a realization that there was gross ignorance about the issue at all levels. And this gross ignorance goes across the board. A lot of people who we think are anti-abortion are actually ignorant about the issue. So having realized this, the African Union worked with Ipas, the Ipas Alliance, to develop a compendium of African abortion laws entitled Interpreting and Implementing African Abortion Laws, which shows what each country could and should be doing within their current national laws and policies. Talking about abortion is not only about changing laws, but includes implementing existing national laws also to their full extent. The document was adopted by the African Union Department of Social Affairs and printed in all 4 African Union languages. And isn't it strange, and I find it strange, that abortion is the only medical condition that is governed by laws in the majority of the world's countries, and definitely in all African countries. Canada is the only country in the world with no abortion laws. That being so, it is important that the legal fraternity be conversant with the issue in all its dimensions. And so with this in mind, in 2013, Ipas partnered with the Judiciary Training Institute of Kenya for a sensitization workshop for judges from 3 Eastern African countries. The meeting was given the lofty name of a colloquium to suit the audience rather than a workshop. The outcome was this handbook requested by their lordships, which provides guidance on the human rights approach to abortion that judicial officers can use as a guide to interpret and apply constitutional provisions and domestic abortion laws. It also takes into account global and regional human rights standards. Recently, in a groundbreaking court case in Kenya, which I'm sure some of you heard about, the Center for Reproductive Rights and country partners won a case against the Ministry of Health, against government, and on abortion. All the 4 judges on the case had been sensitized and trained on abortion following the publication of this handbook. So that was how useful it was. We also have the revised Maputo Plan of Action. I view this document as pivotal in leading us forward to achieve the desired zero tolerance to unsafe abortion, and hopefully safe abortion for all women in Africa who need this. The Maputo Plan of Action 2016 to 2030, as revised by the African Union in 2016, builds on the provisions of the original excellent plan and provides policy direction to member states to address access to safe abortion services. It includes review of restrictive laws and implementing existing laws and providing safe services, and urges states to apply all existing regional and international agreements on abortion. And I believe that it also posits us to achieve the sexual and reproductive health goals of the Sustainable Development Goals. The most important of all, I think, the Decriminalization of Abortion campaign. This was a major further milestone and breakthrough for women's reproductive health rights when it was launched to decriminalize abortion by the Special Rapporteur on the Rights of Women in Africa in 2016. And I had the singular honor of chairing this event in Addis Ababa. Activities continue at regional and country level to realize this goal. And if widely adopted at country level, it will be the single most influential development towards ending unsafe abortions in Africa. So, in the quest for access to safe abortion for African women, what has worked? What is the power of advocacy? I have one great regret in my life. I was privileged to be Attorney General in this country for almost 2 decades in the 70s and 80s. I believe if I had the knowledge and information I now have regarding this social canker, I probably would have done something about it then. For me personally, this is reparation time. This was the lament of a former Attorney General of Kenya following his participation in a 2-day advocacy workshop on unsafe abortion and that we hosted for selected champions in Nairobi. So what did he learn? What did he learn? He learned about the magnitude of the problem of unsafe abortion, that it was a total disaster. Also that it was totally preventable, and that there were international human rights provisions that would prevent unsafe abortions, that we had the Maputo Protocol and general comments, and that the African abortion laws were in the main implementable even as they stand. He also learned that no woman should die from unsafe abortion if things were done properly, and that women can prevent unwanted pregnancy. And we learned that advocacy works, but often slowly. So In conclusion, General Comment number 2 of the African Commission is timely, or was timely, and at the threshold of the new international development agenda that has women's reproductive health and rights as an important and recurring theme. The General Comment is well conceived and well crafted. We hope that it will assist African countries to better understand their obligations to women in this critical but relatively unfamiliar area of health, and to provide the knowledge, the know-how to interpret and implement reproductive health services related to safe legal abortion and contraception in the quest to improve the health and rights of women in the region. Meanwhile, it is incumbent on all of us, advocates and activists, to read and be familiar with the document for our advocacy. It's only 63 paragraphs in 17 pages in a small little pamphlet. And I would suggest that we all try to study it and use it. And my recommendations for next steps would be a wide dissemination of the general comments and to break it down to suit different stakeholders, all the stakeholders that are important in making access to safe abortion a reality for women. We need to support implementation at country level. We need to break it down to health policymakers, legal experts, medical practitioners, all cadres of medical practitioners, to legislators, especially because they make the laws and provide the wherewithal for implementing. Then there are to other related policymakers, to communities, and to opinion leaders, and very importantly also to the media, who, if we work with them, in proactive way, would make this news available to everybody. And very importantly also, we need to spread it to women. And as I said, we need to link it up with the other enabling documents and policies that I just highlighted. So, women are counting on us, on civil society organizations and women's rights advocates to hold governments and international organizations accountable for the commitments they've made. We have an excellent, well-crafted women's protocol that upholds reproductive rights and especially access to safe abortion and reliable contraception. And all our countries have assented to the new international development agenda that calls for access to services that promote and improve women's sexual and reproductive health and rights. The African Commission General Comments number 2 is a valuable document in this regard. But the promotion of women's health and especially their reproductive health is not just a good political, economic, or development decision. It is the right thing to do. I thank you.
Thank you so much, Ambassador Dr. Brookman-Amisa, for that very in-depth overview, especially given the historical context of the Maputo Protocol and what led to the development of the General Comment, the various activities that have been done in relation to generally just the implementation of the provisions of Article 14.2c of the Maputo Protocol, but also in terms of the way forward. I don't think I can add anything to that. And I mean, we're also, as I said earlier, we're also very honored to have you here because rightly so, given your firsthand experience that you had and were part and parcel of the process of the development of the General Comment as you highlighted. So thank you very much, Ambassador Dr. Brookman-Amisa. So while Dr. Ambassador Brookman-Amisa gave a broad overview in terms of the process of the General Comment and what the General Comment entails, now we want to listen to Suzanne Majani in terms of the implementation of the General Comment, especially at the national level. And this is important given that human rights obligations, human rights instruments, including soft laws like the General Comment number 2 on the Maputo Protocol, are supposed to be implemented in the various member states in the various African countries. And more importantly as well, as is also in relation to the impact of the General Comment on the lives of women and girls. And this is where Suzanne will share with us in terms of country experiences with the general comment by showcasing the case studies of Mozambique, DRC, and other countries that are influenced by the general comment. You're welcome, Suzanne.
Greetings, everybody from Nairobi. I'm pleased to be with you today to contribute to the SIAC webinar series addressing the general comment number 2 on the right to safe abortion and access to contraceptives. I've already thanked my prior or previous panelists, particularly Dr. Satang and Ambassador Dr. Brookman Amisa, for elucidating the background of the development of the general comment number 2 and how we can utilize it to advocate to states in the provision of access to safe abortion and contraceptives. I particularly appreciated Ambassador Dr. Brookman Amisa's recommendations on the need to disseminate the general comment widely, breaking it down to suit various stakeholders. This is because whilst general comment number 2 looks at addressing the issue of effectiveness of the Maputo Protocol and Article 14.2c, we need to take a look at the ratification of the protocol at hand. So the protocol that we are looking at is popularly known as the Maputo Protocol, but the official title is the Protocol to the African Charter on Women's Rights. As of April 2021, only 37 states have ratified the Maputo Protocol, ratified and signed the protocol. The latest of these being Sudan, whose cabinet approved the ratification of the protocol early this week. Out of the 37 states that have signed and ratified the protocol, only 2 of these states have reservations on Article 14, one of them being my home country, Kenya, and our neighbor, Uganda. Article 14 is the article that provides for states to take appropriate measures to protect the reproductive rights of women. And despite these 37 states having signed and ratified the protocol, the track record of undertaking the necessary legislative reforms towards domesticating relevant provisions by decriminalizing abortion has been off to a very slow start. For the past several years, the Democratic Republic of Congo has diligently worked on promoting women and girls' sexual and reproductive rights. In 2018, the DRC government ratified the Maputo Protocol, and it was even followed by more progressive moves, such as the validation of the standards and guidelines for provision of abortion services by the Ministry of Health. This was done in December 2020. These remarkable achievements by the DRC government show not only the government's commitment to bringing change in an extremely patriarchal society, but also that of the commitment to bringing change by the civil society in the country. The Republic of Mozambique is also another example that have utilized both the Maputo Protocol as well as the general comment number 2. And the Republic of Mozambique has made great strides in the provision of sexual and reproductive rights after the ratification of the Maputo Protocol. The Mozambique government in 2014 revised the penal code to expand access to safe abortion. After the revision of the penal code in 2014, the Ministry of Health approved clinical standards for the implementation of the abortion law. Although the Republic of DRC and the Republic of Mozambique present great advances in the access to safe abortion through implementation and domestication of the Maputo Protocol, various challenges are still posed, such as the dissemination of the revised or new laws, as well as demystification of some myths rooted in communities in these 2 countries. As we can appreciate across the continent and even across the globe, traditions and societal norms pose barriers to the issue of women's rights within any context. The non-harmonization of local laws and the Maputo Protocol represents a tremendous challenge, particularly because this entails the re-education of an entire society. In conclusion, what I would like to share with you, members in the room, is that whilst we appreciate that engaging with the policymakers on provision of reproductive health during this COVID-19 pandemic is very taxing and it's an uphill battle, we must continue to advocate for the rights of our women and girls, and in the wake of the virus, call upon our policymakers to strengthen, prioritize, and sustain the positive gains on all the health indicators that we have, including reproductive health, access to contraceptives, and access to safe abortion. It's therefore imperative that we in the civil society particularly the NGOs and the CSOs, do the following three things. One, at the regional level, we have been introduced to the decriminalization campaign of ECHPR by Ambassador Dr. Brookman Hamisa, and we would like to urge the NGOs and CSOs to support this campaign through writing of shadow reports and letters, as well as working with your governments to implement the concluding observations to decriminalize abortion in various states. The second thing that we call upon you as NGOs and CSOs to do is at the national level, we need to continue to advocate for the ratification and signing of the Maputo Protocol. We have 15 states across the continent that are yet to do so. The third and last thing that we would encourage you to do as CSOs and NGOs is at the national level, let's continue to call on the 37 states that have signed and ratified the protocol to domesticate it fully so as to decriminalize abortion in their countries. As we have learned from our previous presentation, guidance on this may be sought through the general comment number 2. I thank you for your kind attention, and I hand over back to you, Satan.
Thank you. Thank you, Suzanne, for that brief but in-depth overview in terms of how, for instance, the general comment is being utilized in particular countries, and you give examples in relation to the progress regarding DRC ratifying the Maputo Protocol. And I think that's also, in a sense, is also important, because I think there is, as you highlighted, not all member states of the African Union have ratified the Maputo Protocol. There is currently push for universal ratification of the Maputo Protocol, which is important, especially if we are to ensure the well-being and the full realization of the fundamental rights of women and girls in Africa. And you also highlighted all the other examples of standards and guidelines, as well as revision of penal codes. And I think most importantly as well, especially in terms of how civil society groups or civil society generally can engage in terms of doing the work on the ground, serving as watchdogs for the states, especially in relation to, as you said, examples including contributing shadow reports, but also in a sense as well, just following up in terms of engagement with the concluding observations and so forth. So thank you very much for that. At this point, we are in the Q&A session. I think there are some few questions. I think there are 2 in the Q&A, and I also just saw that there is a question in the chat. So I'll just do the one on the Q&A first, those 2, and then we can come back. The first question that we have is in relation to how can we get sub-regional blocs in Africa to adopt the Maputo Protocol? That is, for instance, I guess, ECOWAS, SADC, but in a sense as well, perhaps to paraphrase the question is in relation to how can we utilize the Maputo Protocol, and how can we utilize the general comment and the best practices that you have shared in relation to utilizing some of the existing opportunities that we currently have in the sub-regional blocs, including the East African bloc and so forth, in terms of progress in relation to sexual and reproductive health and rights for women and girls. And the second question is, what are the major resistance and challenges in the application of the general comment and in general the Maputo Protocol? We can perhaps take those 2, and then we can come back to Tabitha's question in the chat.
I think the first question was, how do we use the Maputo Protocol and the general comment at the sub-regional level to influence women's access to these services? As my grandmother used to say, what you don't know, you can't do anything about. Meaning that these documents need to be disseminated and to be introduced at all levels to the groups and that we know can do something about it. I made reference in my presentation about the abortion to African Union ambassadors, because we wanted to influence them, to influence their constituent countries about these issues. And there was total ignorance about the issue of unsafe abortion. And that was why they suggested that since we say that some countries have laws that allow abortion and so on and so forth, we should develop the document that would help them to do advocacy at country level. So what I'm trying to say is that we need to disseminate these documents more at the sub-regional level, at the regional level, at country level especially, because without it, nobody even thinks about abortion. Nobody knows the statistics about unsafe abortion and the deaths emanating from this. So we as human rights activists and advocates need to do some more work to get these things out there, engage constituents at country level. And I always find it easier to engage at a higher level, have agreements adopted there, and then you can refer to it from country level. So there are several ways of killing the cat. So whatever advocates think would help them most in their particular situation, then we can either start at country level and go ahead, or start at sub-regional level. But like I said, most of these documents that I referred to have been adopted at the highest regional level, at the African Commission level. So we can use that. The next step would be the sub-regional agencies.
Yes, it does. Thank you. Thank you, Ambassador Dr. Brickman. Suzanne?
What I would comment towards using the Maputo protocol at the sub-regional blocks, and thank you so much for that question, Lucky. We have had, as Dr. Brickman-Amisa has said, very good experience, particularly with other regional blocks, such as the South African Development Bloc, or popularly known as SADC, has had quite good and impressive statements and positions that they have taken towards SRHR. Currently, the East African Commission, this East African Community, through its Legislative Assembly, is developing a reproductive health bill. So we would like to encourage that other regional blocs such as Ipas, ECOWAS, and even the North African ones could be able to look at adopting such a format as well, whereby once they have a legislative framework at the regional level, it would be easier to bring it down or to domesticate it within the country levels. Towards the second question about what are the major resistance and challenges in application of the general comment and the protocol? In my experience, we have noticed that we have barriers at the various different levels of society or the community. So we have barriers at the legal level, where you'll recall from Ambassador Dr. Brickman-Amisa's presentation, she shared about the various issues such as requesting for ladies to be able to get consent from their spouses or their guardians. Other issues such as being able to get a writ from a court of law to be able to access an abortion service. We also have the health systems barriers, whereby you'll be unfortunately asked by a healthcare provider to prove or to get consent as well from your spouse or your guardian. We've also seen that unfortunately that those health systems or healthcare providers who are not very familiar with providing contraceptives or abortion services. And then there's also just the general stigma in the health systems sector. The third area of the society that we have seen barriers stemming from is the social cultural aspect. So we've already spoken about the role that culture and our traditions usually have, as well as even other issues to do with education, poverty, and just generally ignorance by the women and girls and generally society. So these are the major resistance and challenges that we have seen towards not only the Maputo protocol, but even now the utilization of the general comment number 2. Dr. Satang, if you'd allow me, I've also seen a question in the chat room about how can we use the special rapporteur on the rights of women in Africa to give credibility to the general comment and to lean in as well to the use of the UN. And from what I heard from Dr. Brickman-Amisa's presentation is that we have had very good work and engagements that we have had with the Special Rapporteur's Office, whereby one, we have had engagements and trainings or workshops and colloquiums with the commissioners of the African Commission on Human and People's Rights. We have also had the Special Rapporteur be the one to spearhead the Decriminalization of Abortion in Africa campaign. And we have also had the Special Rapporteur do statements and calls on countries to be able to decriminalize abortion, as well as just provide an enabling environment for women and girls to access this. I think it's a very good moment or an impetus moment for us to be able to link the two offices of the Special Rapporteur on the Rights of Women in Africa, as well as Dr. Mofokeng, who is now at the UN, who is also a champion for reproductive rights issues. So I believe those are the three that I've seen so far. But back to you, Dr. Satan.
Thank you, Suzanne, for addressing those questions, and Dr. Ambassador Brookman as well. And in relation to your last question, especially regarding Dr. Mofokeng's appointment, I mean, as Africans, this is a huge achievement as the first Black African to be the UN Special Rapporteur on the right to health. And I think in a way, as you rightly said, I think we need to, as civil society, especially civil society that works on sexual and reproductive health and rights issues in Africa, we need to find a way of building synergies between the two, especially in terms of, as Tabitha rightly said, in terms of witnessing the emerging trend in the rise of fundamentalism, but also in a general sense in terms of undermining and very much connected to the previous sessions of the webinars in relation to the independence of the Commission, and how, for instance, we in a sense, the Commission as well as civil society need to strengthen the mechanisms in order to ensure, the sexual and reproductive rights of women and girls in Africa. So I think in a way we can work with both mandates as well. And just to say that at the Center for Human Rights, myself as well as other members of the center are actually supporting us now currently the mandate of Dr. Mofokeng as well, especially in relation to the work that she's doing at the UN.
Still on the stigmatization and so on, as I stated in my presentation, the criminalization of abortion and the fact that it is in the criminal or penal code of our legal, of our laws, put it in the crime and punishment paradigm. And therefore, from those times, in the early 19th century, everybody has sort of grown up thinking abortion was illegal and criminal and wrong. And then more recently, the stand of the church, especially the Catholic Church, and also some powerful, influential governments, like we know who I'm talking about, during certain regimes, have all contributed to the stigma of surrounding abortion, such that sometimes, because these powerful nations give money to our ministries of health to work with, they are reluctant to work on unsafe abortion. So these are huge issues that we will need to confront as we go on with our advocacy work. But I think decriminalizing abortion in Africa is going to go a long way to improve the situation. I just thought I would mention how important the decriminalization process would be.
Sure, no problem. Thank you so much. So Cecilia's question is whether there are currently any initiative or engagement around Agenda 2063 to advance safe abortion as a key element to sustainable development, and how we see what opportunities there are in relation to advancing women's reproductive rights and safe abortion.
I think Cecilia should be answering that question for us.
I can go first, and then we can hear from Ambassador Dr. Brookman-Amisa and Cecilia as well. But the opportunities that I envisage from the Agenda 2063 is one that has been shared in Ambassador Dr. Brookman-Amisa's presentation, which particularly under the AU Department of Social Affairs, we usually have the CAMA reports that are done. This is the Campaign on the Accelerated Reduction on Maternal Mortality in Africa. So this is particularly something that we could be able to look at under the auspices of the AU that would also drive Agenda 2063. That's one that I would immediately look at.
Thank you, Suzanne. And just another question. This is great engagement. The question is, considering that some or most African countries have harsh legal regime on abortion rather, what do you think could be done to bring about decriminalization of abortion in general? For instance, Jundu gave the example of the Gambia, where resistance from religious leaders and scholars will be a sure obstacle in terms of abortion reform.
Dr. Satang, do you want to take that one yourself? That given that Gambia is your home country?
Now you're putting me on the spot. I'm supposed to just ideally be moderating this session. No, but I think he's particularly right. I think in the Gambia currently there is conversation around how we can build on the experiences from other countries, including Kenya and other countries, African countries that have made inroads, as you rightly said, given examples of the DRC, Mozambique. Ethiopia also is another case study in terms of drawing best practices to especially engage progressive parliamentarians. I think in a sense, I think one of the first thing in terms of strategic focus is to build a coalition, because I think there is need for a movement in terms of movement building to bring together a collective of like-minded individuals and organizations, including lawyers, health professionals, activists, media professionals, to bring them together, because I think that's important. And that's one of the first elements that we're doing, especially in terms of setting up the sexual and reproductive rights network in the Gambia. But in a sense as well, I think the Gambian case is also unique, given that currently we're going through a transition from an authoritarian regime to a democratic system, where there are currently transitional processes, including hopefully ultimately getting a new constitution, as well as the overhaul of the whole criminal justice system that really responds to international standards and guidelines. So in a sense, we can utilize those opportunities and mechanisms to push for, to advocate for, to make noise as well in relation to that. Yeah.
And also the use of examples. Religion, and there's no religion that's against abortion. Tunisia, a very strong Muslim country, was one of the first countries ever, even before the UK and France and the US, to have a legal abortion law passed, right at the time of 1960 something. And so that is something, an example that we can use for advocacy. Ghana has almost the same law as the Gambia. Mm-hmm. In Ghana, abortion services are being provided both at the government level and in private practice, because of the way advocates in the country came together, led by the obstetricians and gynecologists and the Ministry of Health, to interpret the language of the law to make it accessible to women. So it can be done by example, and like you said, forming coalitions so that all manner of people who are in advocacy get to know what they can do in their respective countries. I think it's a very important issue, interpreting the law. And the document that that I made allusion to, abortion laws compendium, also actually enumerates for every country what they can do within their law. So that can be a starter as we work to decriminalize also. Thank you.
Thank you for those, well, as somebody from the Gambia will take notes as well in relation to the recommendations. And I just wanted to also reiterate something important that you said, especially given the context of Gambia, where religion plays a major role in the lives of people. I have been earlier this week in certain spaces where, for instance, I have flagged the idea, which is not new. Organizations on the ground are doing it in terms of thinking around engaging faith-based actors as well as religious actors in relation to the full realization of sexual and reproductive health and rights in a sense. And you're particularly right in a sense in terms of that, whilst we think religious actors are usually the opposition, we also know that there are those that also support sexual and reproductive health and rights. And in a sense, we also need to think around how we can use religious texts in order to advocate for, to lobby for, to change minds as well in relation to women and girls' sexual and reproductive health and rights. So thank you very much. At this point, I wanted us to take a quick break, not a break to go, a break to actually watch the video in which Suzanne speaks on the right to safe abortion services and access to contraceptives, and she mainly focuses on the general comment number 2. We can do the video, which can be like a short break. You can chill, enjoy it, and we'll be back. And when we're back to the plenary, we'll take those last few questions or any other comments that you have in the comment chat before we wrap up.
My name is Suzanne Majani. I work with Ipas Africa Alliance as a regional policy advisor. Ipas Africa Alliance is an NGO that works on access to safe abortion services and access to contraceptives as well. We work across the region of Africa. We are based in various countries, as well as supporting countries that need to be able to access safe abortion services and contraceptive services. The general comment number 2 was on the backdrop of the Maputo Protocol, because the Maputo Protocol had been in place from 2003, but then countries were not really enforcing it. So the reason as to why general comment number 2 came in place was to assist countries to be able to know how can they really operationalize Article 14.2c of the Maputo Protocol. Working with the African Commission has been a very interesting process. So in the process of us working with the Commission, we have had a circuit of about 3 or 4 commissioners. And so you can imagine every single time you need to be able to capacity build or to engage with commissioners because of the issue that you're working with. So the initial commissioners that we started off working with are not the current ones that we work with. But then we were fortunate enough to have commissioners that were understanding of the issue at hand and were able to bring about the general comment number 2 to be passed. It was a process that took a couple of years, though, because we were looking at the statistics in the African continents that we work with. We have about, at the global level, we have 25 million unsafe abortions that are done on an annual basis. And obviously, most of these are in the third world countries, so mainly in Africa, Latin America, and Asia. So we were able to bring these statistics to the Commission and show them why we need to be able to have the general comment number 2, which, as I've said, is to bring about how can we implement Article 14.2c of the protocol. So once we were able to bring to them the statistics, they were able to say, okay, this is an issue that we need to be able to address as the Commission. And they were able to say, how can we do this? We had seen the success of the general comment number 1, which is on HIV and AIDS. And so we said, how can we do a general comment on access to abortion services and contraceptives and information? Yeah. So we met with the Commission, we met with champions who know the issue, we met with women and girls across the continent, and then we were able to table this at an ordinary session of the African Commission. After it was tabled at the session, they were able to deliberate about it with the members of the African Commission. They were able to deliberate about it with the states, and then now it was officially launched and passed after a couple of years. That was a 2-year process. So this was 2013 to 2016. I would say the impact of the general comment has been twofold. There has been decriminalization of abortion in some states. For instance, we have had the decriminalization of abortion in Mozambique during the period of the general comment. During the period of the Maputo Protocol, there has been a lot of decriminalization of abortion across various states, such as Ethiopia and other countries across the continent. We have also seen, after the general comment number 2, we have seen countries are now opening up or releasing their barriers on access to safe abortion, be it cost issues, be it consent issues by your spouse or your guardian, be it timing of the facilities. Women need to be able to know how do they get these abortion services and contraceptive services. And we have seen that countries are now reporting to the Commission on how are they able to do this particular enforcement of services and provision of services. So I would say that has been the achievement of General Comment number 2. The unfortunate thing is that the Commission has not been independent per se. So you'll find that, for instance, if a commissioner comes from Kenya, and this is not to say anything about the commissioners that have come from Kenya, because we have had a few, but if a commissioner comes from Kenya per se, they feel like they need to have that allegiance to their country and to what their country espouses. However, they need to remember that now they're wearing a regional hat. So leave the issues that you are handling back at home in Kenya and come with the independence of what are we looking at the continental level. So the commissioners are usually about 11 to 13 part-time. And so a lot of times you'll find them having that challenge or having that conflict of interest, that they want to be able to remember what is happening back at home so that they're able to continue with their mandate for the commission, as well as now come up with when they need to either be re-elected or taken back to the commission. So I would say the independence is needed because of that, because of the need of having someone be able to make an independent judgment or an independent case when they're having their mandate at the commission. We also need an independent commission because of the issue of the funding. Sometimes because the commissioners feel that pressure from the African Union itself, they feel like sometimes they need to be able to have that allegiance to the general organ of the African Union. Because I'll give you an example of, unfortunately, when the Commission was giving observer status to the Commission of African Lesbians. They gave the observer status but withdrew it because of the pressure of the African Union. So you can see the lack of independence there, because the Commission understands the need to be able to have such a coalition having observer status at their level. But because of now the African Union giving them pressure of, if you don't do this, then what would be the ramifications? So that's why we need the independence of the Commission, both from guarding them from the pressure of the state and guarding them from the pressure of the African Union itself.
Thank you. Thank you very much, Suzanne, for that great video, which really gives an oversight into the general comment, but also in terms of the right to safe abortion services and access to contraceptives. As I said, all the links in the different languages are actually in the chat. I'm just going through the chat. I think we have 2 other questions on the Q&A section. We can address those, and then we can summarize and discuss, especially just last thoughts in terms of way forward, and then we can wrap up the session. The first question is in relation to, in terms of what are some best practices and strategies we can utilize to help strengthen the Commission and its mandate, given attacks to, I guess, its independence, but just attacks as well, just generally related to the mechanism, and how we can strengthen its legitimacy. Perhaps we can take the question and then come back to the last one.
Sorry, being in retirement, I'm not fully competent with what is happening with the Commission at this time. So right. I'd like to refer to Suzanne.
No problem. Suzanne?
Thank you very much, Dr. Satang, for that. And Ambassador Dr. Bruko Namisa, I can assure you that the same things that you taught me when I was new and young in this advocacy arena is the same things that are relevant today, because the biggest challenge that we have noticed to the Commission is, as the question has rightfully asked, unfortunately, there's a lack of independence, and this also now begins to shroud the legitimacy of the Commission. An example that was given as at the beginning of the session, Dr. Satang shared with us that this webinar we are attending today is within a series of webinars that the SIAC is having. And the initial webinar session was also addressing challenges to do with the legitimacy and the independence of the Commission. And a particular example was given then for those of us who have been in this space of working with the African Commission. There are organizations that apply to have observer status with the Commission. And one of these organizations was the Coalition of African Lesbians, an organization that is rightfully registered in Africa, is run by Africans, and is based in Africa. Unfortunately, Carl was given observer status by ACHPR, but this was withdrawn on the behest of the African Union. And this really speaks towards the independence that the African Commission has. So what I would suggest towards the Commission would be, towards strengthening their independence, they need to be able to look at the instruments that they have, that they operate under with the African Union, as well as impress upon other ways that they can be able to get either support or funding, so that they don't just rely particularly on the African Union for this level of support.
Thank you. And just to add to that question, I think in a sense, this webinar, including the series of webinars that we're having here, are all strategies towards strengthening the independence of the African Commission. And that is really the rationale for the establishment of SIAC. SIAC, as I said, is the coalition of on the independence of the African Commission, which is a collective of individuals and organizations, civil society, who are coming together in different ways, whether making commentaries on the rules of procedures of the Commission, whether making really taking other strategies in relation to supporting the mandate of the Commission, especially in executing both its promotional as well as its protective mandate and interpretation mandate as well. And I think this webinar is a way, is one strategy in which we are contributing towards strengthening the mechanism, especially in ensuring the fundamental rights of all people in Africa, but specifically in relation to this panel that is in terms of sexual and reproductive health and rights. So the last question that we have is, it says, does the Safe Motherhood include establishment of crisis pregnancy centers? I will, in a sense, paraphrase that because I, through my research and work, especially around abortion in South Africa, which has, in a sense, one of the most liberal abortion regimes in the world, we do know that currently there are efforts to encroach on existing abortion rights in South Africa. And one of the ways that they're doing that is through the pregnancy crisis centers, which personally I'm not saying are bad, but in a way, but in a sense, the anti-abortion movement is utilizing the crisis centers to spread misinformation, especially in relation to abortion access, but in a sense as well, utilizing it as an oppositional strategy. And I would like to hear your thoughts, especially in terms of, and I would paraphrase the question and say, in terms of how do we think we can utilize the Maputo Protocol, the General Comment, and other existing documents and guidelines and standards, as Ambassador Dr. Brookman-Amisa rightly stipulated, to address emerging attacks and challenges, especially from individuals that are not supportive of the movement and supportive of abortion rights generally.
Yes, I'm also familiar with these abortion crisis setups, whatever they call them, from my time in Kenya. And there are anti-choice and anti-abortion organizations, as you rightly said. So they represent the opposition to women's access to safe abortion. And they use coercion, and false information and, damnation and hell and that kind of thing, which I think, robs women of their rights. And so these are not people that we are working with. And I wish that they could be brought around to realize that they are working against, African women's rights. But of course, they want to do what they want to do. And the people who claim that the mask doesn't help you. So, but they are not working in conjunction with the advocacy for access to safe abortion as such. So we're not in the same camp. That's what I would like to say.
Thank you, Ambassador. I think that's important to note, as I said, there is the pregnancy crisis centers are really a landmine for misinformation, especially in this age of fake news, fake information, and everything. And it is, in a sense, utilized as a strategy to deal with or try to, especially. And I think, in a sense, I think that is the reason why there is urgency to ensuring the implementation of the general comment, because what we're seeing in quite a lot of our own countries is the fact that there are strategies, whether they're legal strategies and whether it's the utilization of the media or in a sense other strategies in terms of clawbacking on already the existing rights that we have in relation to sexual and reproductive rights, but specifically in relation to abortion. So at this point, I wanted, if we don't have any more questions or comments on the in the chat, I just wanted to hear your final thoughts in relation to how, I know you already gave recommendations, but in a sense, in terms of how do we move forward to ensuring that we are able to utilize the general comment in such a way that it's useful, that it's impactful, and that is making a difference in the lives of people. Yeah. Okay, Suzanne, go ahead.
Thank you very much, Dr. Satang, for your able moderation, as well as also being able to jump in with feedback and comments to the session. What I would recommend to the members in the room, to the participants that are joining us both on Facebook as well as in the Zoom call, I would recommend that we need to have what we know as the different advocacy approaches, especially from the ground up. Particularly, I liked Dr. Satang's recommendation that we need to have coalitions and community-driven agendas, because the community voices are who will shape the policymakers' views and ways forward. Another thing that I would like to really encourage us as organizations working here is already Dr. Brookman Amisa has asked us to look through the general comments and be able to familiarize ourselves with them so that we can use them for advocacy. So this is something that's very important, because once we know what is within the general comment alongside the Maputo protocol, we can be able to advocate to our countries to provide to women and girls contraceptives and the option of safe abortion. Thank you.
And before I call on Ambassador Dr. Brookman Amisa, I also just wanted to say, and take this opportunity to shout out Family Watch International. We have Augustine Kakutu, and Family Watch International is a pro-family organization that works in various African countries. And in a sense, they are part of the opposition. So we're actually happy that they came to this particular space to learn more about the general comment, to learn more about the existing mechanisms, because I think also in a sense, given the emerging attacks that are encroaching on women's right to safe abortion, it is also important that we reiterate our commitment to ensuring women's access to abortion services for women in Africa, and also ensuring that their voices are heard, that their choices are respected as well. So thank you for being in this particular space, and we hope that you're able to get some things out of our discussion on the general comment and the Maputo protocol, especially in terms of pushing for access to abortion, but also in terms of respecting women's right to sexual and reproductive health and rights. At this point, I would like to call on Ambassador Dr. Brookman Amisa for her final words before we wrap up the panel. Thank you.
Thank you so much, Suzanne. A lot has been said, and I won't go on for too much longer, but I agree that the African Commission should be independent. But it was meant, it was created to be independent, and so it is a worthy cause that we should try to maintain its independence. Having said that, I'll go back to the topic and to say that the general comment is number 2, is on the website of the African Commission. And I would urge all of us to read it and understand its provisions, and also how we can use it and especially together with the other documents and policies that have been developed in the region over the years, documents that have the backing of the African Union and some regional agencies, to use all of these in advocacy work at regional, sub-regional, and national level. And my final word is that African women are counting on us. We shouldn't let them down. Thank you very much.
Thank you. Thank you, Ambassador Dr. Brookman Amisa. And just in terms of your final words, that African women and girls are counting on us. So that means that we cannot in any way relax in terms of our commitment towards the full realization of sexual and reproductive health and rights for all women and girls in the continent. And also just to add that Jundu, for example, also added that there is need for mobilization of women and men as allies, which is crucial, given that our politicians would obviously not act only when they know that there is a price to pay if they do not decriminalize restrictive abortion regimes. At this point, I just want to take the opportunity to say thank you very much to our very distinguished panelists. I know that Ambassador Dr. Brookman Amisa is in semi-retirement, but is as working full-time as ever. But we are very much appreciative of you being here. And Suzanne, obviously, thank you so much for organizing this, but also for, for taking the time as well to be here. I also want to take the opportunity to thank everybody for attending this webinar, for sharing your thoughts as well, and have a very good day. Thank you.